as our listeners and our members are essentially global, they're across the world from New Zealand to South Africa to the States, and they're in multiple settings. So whether it be in hospital-based clinics, in multidisciplinary clinics where there's a varying levels of integration of services, or in a standalone practice. We've got such a wide array of listeners and users. What is really the bottom line, the essential elements of skills that those clinicians need to work on this year, 2018, in order to move themselves forward as authorities in their circle of influence as evidence-based, patient-centered clinicians?
Yes, the primary spine practitioner skill set and the services they provide for patients can be provided for patients in various different environments. I have practiced as a primary spine practitioner in a private practice environment. I now function as a primary spine practitioner in a healthcare system, and I've trained several hundred people, and I have the PSP training certification course with the University of Pittsburgh that is designed to provide knowledge and skills that is best allows the chiropractor to best apply these knowledge and skill set areas in whatever system they work in. So they may be in private practice, they may work in a hospital, they may work in a multidisciplinary facility, they may work in a facility that is mostly primary care, that they're functioning as a primary care person in the spine area. There are various different environments in which primary spine care can be provided. The bottom line, the commonality is primary spine practitioner having the knowledge and skills to be able to provide primary spine care. Then you plug yourself into whatever environment works best for you or is available to you, the opportunities that you may find out there. You can apply those same knowledge and skill sets in the various environments in which you may find yourself.
Brilliant. Well, so one of the interesting things that came up in the first webinar that we did with the user base, the member base, was a question that went out on a poll. And the question was, what is the most important skill for a PSP to have? And there was a weighting of, it was almost a 50-50 answer. In the answers were diagnostic skill and communication. And it was interesting in that respect, and I'd like to get your input on this as to, you've obviously communicated with not only patients, but with their care teams, whether it be the primary care physicians or the specialists, the orthopedic surgeons, etc. You've obviously had to develop an ability to communicate, and presumably that's been a hugely advantageous skill to have developed over the years. Would you say that is something that needs to be worked on? And
that's one of the central skill sets that primary spine practitioners needs, is the ability to communicate. And communicate with whom? Communicate with patients, communicate with other professionals, other healthcare professionals who may be playing a role in the spine care program, communicating with the community, communicating with other members of the healthcare system that may be part of not the medical part, but the administrative part. So the ability to effectively communicate with various people who play a role, that's a very important aspect of this. And there are many different skills. There are diagnostic skills, as you mentioned. Differential diagnostic knowledge is important. Communication is important. Manual skills are important. All of those things are important. Each individual one is important and essential, but not sufficient to function as a primary spine practitioner. You need to have all of these different skill sets all in a package that you can then apply in the different situations in which you need to apply those skills.